Addiction is devastating to the addict and their family and has become a public health emergency. People with depression or other mental health problems are particularly vulnerable to alcohol and drug use. Dr. Tonmoy Sharma is the CEO of Sovereign Health, which provides advanced evidence-based treatment in a safe, nurturing environment. Dr. Sharma discusses the state of addiction treatment.
Sovereign Health is a national behavioral health system of care. We provide treatment for people with mental health issues and those that suffer from addiction and eating disorders. When I looked at the mental health and the addiction scene, there was the high-end place in Malibu and various other places, and then you had county facilities. Nobody really was looking after Middle America. There was nowhere that you could really go that provided good treatment. So the aim of Sovereign has been to provide good quality treatment for people that had insurance.
Treatment center standards vary between states and facilities.
There are differing standards in terms of the addiction treatment industry and differing standards across different states. For example, in California, you don't need to have any qualification to open up a treatment center. Sovereign Health is a group of physicians and psychologists that have been trained and have practiced in the behavioral health field. And we are very interested in making sure that there are standards of both assessment and treatment in the industry, and that we are held to this higher standard, and that people have confidence when they come for treatment, that they are coming to centers that have got not only licensing by the relevant states that they are placed in, but also they have got accreditation by the Joint Commission, which is voluntary, which is above and beyond the licensing requirements.
Treatment for addiction may also need to address mental health issues.
About 60% of people with addiction also suffer from a mental health disorder. For example, if you are drinking, you also are likely to be suffering from, say, depression or bipolar disorder. So it's important that somebody who is treating you doesn't just have a counseling certification, that they have the wherewithal to also treat your depression or your bipolar disorder. And we know that the outcome of those that get treated concomitantly for the mental health issue, along with the addiction, have got better outcomes. There are better outcomes for such people than those that are just treated for addiction alone.
Originally, I came to Sovereign because I had admitted that I needed help with depression, but after speaking with someone over the phone and going over what was going on in my life, I realized and was able to admit that I not only had an eating disorder, but I also had a drug addiction as well, to prescription painkillers.
Melissa started using painkillers at a young age.
9 or 10, I started taking them. People in my family take them for back pain, and it just goes from there. I was 15 with Oxycontin and morphine at my disposal. And I was a good kid. I was a band kid, but I was passing out in the music room with sheet music because it was not only so readily available, but given to me.
Treating addiction is not a quick cure. It needs to be seen as a chronic disease.
Medicine only can cure infections and nothing else. Most other conditions that are chronic, like diabetes, hypertension, asthma, need chronic management. And so we need to look at treating addiction like we treat diabetes, with chronic and long-term care. We should look at how we manage the lives of people with addiction, with long-term plans of how they are going to be in recovery.
Melissa tells us the moment she decided to change her life.
With my eating disorder, I had a chunk of my hair fall out. And I remember years before, the one person I opened up to about my eating disorder had told me that that could happen, and me being in junior high thinking, that wouldn't happen to me. That's if you've been doing it for years. Well, then you look back and it is years later, and that does happen. With my drug addiction, it was seeing someone that I didn't know from Adam get really physically injured, and not wanting to be part of that life anymore, and just seeing everything that I had worked on and put effort into go away. When you have those moments, it just makes you realize what kind of person you are and what kind of person you want to be. And the person I wasn't the person I wanted to be.
Coming up, we'll see how Melissa is doing now and how continuing care is crucial for long-term recovery. The road from addiction begins with rehab and continues throughout a person's life. Dr. Sharma outlines how care plans are customized for their patients and how success is measured.
Treatment actually begins after rehab. We need to be engaging with people that we discharge. Just like somebody with diabetes, then the person is getting their blood sugar done, they have their dietary instructions, they often see a nurse. There is a full plan of action after they have finished treatment in a hospital. We should continue to do the same with people with addiction. Only then can we succeed in our treatment plans for addiction. Once we've changed that mindset. So there is the requirement of a paradigm shift in the way we are treating addiction. And at Sovereign Health, we do this. We continue to engage with people that we discharge.
Continuing care is provided to help patients achieve, manage, and maintain long-term recovery.
We developed a clinical concierge team that follows patients for up to 5 years. About 70 to 80% of people have got really good outcome if they're monitored and followed up even after 5 years. We want to decrease their relapse rates. This is counterintuitive to a business model, but is good for functional outcome for the patients because then it helps them reintegrate back into society.
Supportive staff and resources are necessary to empower patients with their recovery.
I would say the main difference for me, for Sovereign, was the acceptance right away. I felt like I was surrounded by people that understood me for the first time in my life. They understood the limbo that I was in, wanting to live, not wanting to die, but also wanting to die and also not wanting to live. That depressed state, that constant battle with just getting up.
Melissa reveals how she's doing now.
I'm wonderful. I have a chocolate lab. I can eat full meals without, overanalyzing and thinking. I can go into a doctor's office and confidently say that I cannot take any narcotics, any opiates, any controlled medications. And rather than feeling a stigma about it, I have a confidence about it, that I overcame it and that this is the real me. That's it's kind of a saying in my family now, finding the real Melissa. So it's the real me. I'm myself, who I want to be.
Dr. Sharma tells us how gratifying it is to be able to help people and how Sovereign Health is helping.
Humbling that you can help 600 to 800 families every day, that you can save when there are 90 people dying from opioid overdoses every day, that you can play a small part in preventing those people from killing themselves. Things that you put in place actually saves lives. Things that you do have a meaning, that what you do leaves a legacy, that you create a system whereby there's a tectonic shift in how people think, and it's not incremental.
Combining individualized care and management of both addiction and mental health, Sovereign Health is helping each patient and their families move forward in their lives.
Success is measured by the number of people that we can serve. We also have been pioneers at combining the treatment of addiction and mental health within the framework of what we treat, and having a recovery-oriented system of care and a continuing care model. And creating this paradigm shift has allowed us to be different from the rest of the people. And I think, I hope that everybody else will look at us and say, well, maybe there is something to what these people are doing.